So we're now going to be moving over to present with Nora Khaldi, who's from Nuritas. Nora, are you with us? Yeah, you are. Hey. And we've covered some of the work that Nuritas has been doing specifically in peptides. Most recently, a discovery about diabetes and a rice-based peptide as well, Nora. So very excited to hear about what you're going to tell us today.
Yes, perfect. Again, thanks for the invitation, for the whole team for Connexum. Thank you, and Thomas, nice to see you again. So my name is Nora Khaldi. I'm the CEO and founder of Nuritas. My background is pure mathematics and computer science, and I'm going to tell you a little bit about Nuritas today, and I'll keep it short. Really, the goal of Nuritas is to create sustainable health-promoting molecules from nature at scale. And I'll tell you a little bit about the history if we go next to the next slide. So what's interesting, if you look at the history of all ingredients discovered in the area of especially health-promoting ingredients in our history as humans, they've all really been discovered by serendipity. And it took decades to discover them, then decades to understand what they do scientifically, and then maybe more decades to actually be able to scale them and to be able to commercialize them. And literally that's most, or if not all, ingredients that we currently use in our foods and our supplements and so forth. And what's interesting as well is that because of those decades of research and identification and the fact that, you know, that they've been produced by different source materials, and the fact that we've worked on them for so long, they cannot be patented really. And for many of these, we still don't know really how they work. So, so this is the status quo really of what exists currently. It's really total random discovery, and it takes decades to actually take that discovery to true impactful science with consumers. We'll go to the next slide. So what we do at Nuritas basically is that we remove that serendipity and the random nature of ingredient discovery. Through the platform we've put together, we now are able to unlock and scale health benefiting ingredients in about a 2 to 3 year cycle, as opposed to the decades and decades. And I'll tell you a little bit about it, but 2 years is basically the time where we go from a concept of an idea, we want to create something that reduces circulating TNF alpha, for example, or reduces muscle wastage, or an area of focus, to actually identifying a source material that would have molecules within that we can patent, that actually would perform clinically to that end, and that we can actually scale at a cost of goods that actually is commercially viable as well. So we go to the next slide. So as consumers are becoming more knowledge-based, there's this whole trend of wanting things that are sustainable, that are plant-based, that are natural, that are transparent, and more scientifically proven. And not just any science, but really like peer-reviewed, scientifically proven, and it works for me. And I want to know how they work and why they work and so forth. And that consumer trend is becoming, it's accelerating with technology, and consumers are becoming a knowledge-based consumer, and the food industry in general is becoming a knowledge-based industry as well. And really the need for these types of ingredients has increased dramatically, especially in the past few years. And as technology grows, the need for those ingredients grows as well. So as we go to the next one. So Nuritas is not about, again, taking what is already discovered and improving it incrementally. It's really about creating new sustainable products with real health benefits in poorly addressable markets. So we start off with a source material, an organic source. We focused initially on plants and specifically foods initially. We use our platform, which I'll explain a little bit more. Basically, at the end, you get a powder with certain, that is fully characterized with certain molecules, and we know how they work to perform certain activities that we want them to perform. So if we go to the next one. So, yeah, so basically the technology is really driven by 3 unique capabilities, but the biggest capability we have is that AI can take you so far, but really it's that integration between AI and being able to quickly test in the lab, being able to scale the product, being able to know whether that molecule that you discovered in nature is stable, is it going to be bioavailable, is it going to Is it going to sustain the scaling process in terms of heat and pressure? Can we extract enough out of the plant itself to create something that has a cost that is important for from a commercial perspective? And is it going to work in human? What is the likelihood of it working actually when we do a clinical and take it into human? And also, is it going to be oral? Because these things cannot be injected, they have to be oral. It really is that integration of everything together. So we do not move unless a molecule has been predicted to have all those boxes ticked. And then we go into the lab at small scale, test those hypotheses, and go back again to the AI to see if we can actually extract those molecules properly. Are they stable? Are they bioavailable, etc. It's also the integration between, we have now probably one of the largest databases of food samples or plant samples from around the world, both marine and terrestrial, where we take samples from around the world and we do a lot of proteomics to understand what's in them and what's unique in those plants as well. And then separately, we've created a very large data set of proprietary data set of experimental data where we tested peptides on different cell types and looked at the phenotype of the cell and the effects of the peptide on the cell in different ways. But also we've used a lot of the public data that's out there and formatted it to suit our own software. And together we're capable of now creating ingredients and taking them the full way with an accuracy of 65%. So 65% of what we predict physically works in the real world in human. It goes from an idea to actually physically working in human, which is a massive number. It's 5 times plus, so it's over 5 times faster than the average ingredient discovery cycle. So we do it in about 2 years, 2 to 3 years time. And then for every plant, we're talking about billions of molecules. We're specifically interested in peptides, so billions of peptides. But so far we've fully been able to characterize and understand the activity and extract about 3 million peptides so far successfully from different plant sources. If we go to the next one. So some of the products that we've matured so far. So I'm going to talk about 3: PeptiStrong, PeptiForce, PeptiYouth. And they really tick all the boxes on the side. So they're patented, and this is global patents. They're manufactured at costs, so we can actually extract sufficient quantity that makes it viable commercially. They're food grade, and that's important. This is why we focused initially. We could have gone after any botanical, any sources, but we really focused on food because we believe the route to market is shorter, plus it's food grade. It's still considered food grade. It's non-GMO, so it really ticks all the boxes that consumers are looking for as well, and food companies and dietary supplement companies are looking for as well. Personalizable, because we understand what works within them and what are the active molecules that are responsible for the activity. Peer reviewed, we're publishing on multiple on them, multiple, or they've either been accepted or some of them are still under review. They're all plant-based, and I'll talk to you a little bit more. But if you go to the next one, specifically PeptiStrong. So PeptiStrong is one that we're launching in 2021, early 2021. So it's the first plant-based, sustainable, scientifically proven natural product to restore muscle health. We've done a lot of preclinical work. We've done clinical work. The clinical work is being done in the lab with Professor Luc Van Loon in Maastricht University. We have the interesting part about PeptiStrong is that it's a combination of molecules extracted from fava bean, specifically interested in 3 different pathways: phosphorylation of S6 for muscle synthesis. We're interested in reducing the expression of certain genes that cause protein degradation, and then we're interested in reducing TNF alpha as well. So those are the 3 pathways we went after, and the goal was identifying a source material that could actually would have benefits, would have peptides that could actually alter those. So the preclinicals were in disused atrophic mice, and currently the clinical is in humans casted for a period of time with and without, so double-blind placebo-casted with and without the oral peptistrong. If you go to the next, the other thing that's interesting, so I'm not going into details here, but the other thing that's interesting is that we actually, the main thing that that we're bringing as well is that when you identify these molecules that carry that activity, you want to know that they can actually sustain digestion and that they go to where they should go. And this is very, very hard when you're talking about mixtures and natural products. And this is why we brought in completely new methods, more pharma-like methods in this area as well, where we're actually following the compounds, at least from an in vitro perspective, and we're going into in vivo with this as well, following the molecules. If you go to the next one. So peptistrong will be composed of different types of peptides. We're focused here, I'm showing you two specifically, carrying the activities we want them to carry. So increased protein synthesis, two peptides carrying that functionality, and then another one, reduced inflammation. And like I said, this is a triple action peptide network. And really the goal for us was, are these peptides that are carrying the activity of the overall source material, are they actually behaving the way we want them to? Are they sustaining digestion because they have to be oral? Are they, this is before we went into the clinical, by the way. So if you go to the next one, we did, we did a lot of GID work. Simulated gastrointestinal digestion. We did a lot of co-culture model to see bioavailability of the peptides, and then PK, once they get into blood, how long do they last? And what's interesting is that a lot of these molecules from the fava bean that we extracted, sustain digestion, they actually are bioavailable, and when they enter the blood, their PK is actually really interesting. Again, this is in vitro, and we are carrying that out in vivo as well. But some of the peptides are actually very robust and stable, and this is the reason we can scale them as well. When we're scaling, there's a lot of pressure at scaling these molecules, a lot of heat, and you really need some robust peptides to actually sustain all that. So one of them, for example, a half-life of over 2 hours, which is good. I'll move to the next one. Next one is peptide. So peptide is one of the peptides we've discovered also from pea. This one actually specifically in the anti-aging arena. Specifically, we could have gone oral with it, but we went topical. Again, double-blind placebo clinical, which is published. And really there we were simply looking at wrinkle depth, specifically with this Primos 3D, and in a 28-day cycle. It's the world's first plant-inspired, non-modified, clinically proven aging peptide.
1 minute, sorry. 1 minute, yeah. Sorry.
Okay. I'll go to the next one. And then the world's first, again, ingredient clinically proven to actively improve glucose metabolism. This one's really interesting. It's from pea again. It's oral. This one was, we've done quite a lot of preclinical work and clinical work. And I just want to finish off. Yeah. Sorry?
Sorry, there was somebody talking on the line there, Nora. Please carry on.
Yeah, no, I just want to say, I'll finish here. I have other slides, but I won't go into it. But I just want to say that we're happy to send samples to around the world for testing. If people are have assays or clinicals ongoing, happy to send all of these samples. And we have other areas as well. If you go to the next slide, just a quick look, but many other areas we're developing products in as well.
Great, some fascinating work going on there, Nora, and I'm sure you're going to get some people joining you in the breakout room. So thanks very much for your presentation today. That was really great. Thank you.
Sure. Yeah.